I had a 75-year-old woman come into my office with left hip pain, increasing pain and dysfunction and difficulty walking and feeling that her legs were uneven. She came in with her daughter, and her daughter noticed that her leg length difference was significant and that she was now walking with a walker. So we evaluated her in the office with x-rays as well as a physical exam, and it's important to know that she had a hip replacement several years ago. Her hip replacement had eroded higher up into her pelvis, causing effectively a leg length difference of almost 2 to 3 inches. And this was causing her pain and dysfunction and why she couldn't walk. So we talked about revision total hip surgery at the Miriam Hospital with our specialized team, utilizing our specialized operating table and techniques. We discussed that there are many ways to do revision total hip surgery, including through a posterior approach, which is through the muscles through the back of the hip, a lateral approach, which is through the side of the hip, or the anterior approach, which is through the front of the hip, and it works in between the muscles, not cutting any of the major muscles. It is minimally invasive and can be done through about a 3-inch incision, which allows a quicker recovery and less pain post-operatively. So we elected to do this through an anterior approach. She had significant bone loss from her previous total hip replacement and its failure. So this required specialized equipment that was brought into the Miriam Hospital, including acetabular augments, which are porous metal augments that are placed into bone defects and allow the bone to grow in and allow us to place the hip to where it used to be, where it should be, to effectively give her even legs. The other advantage of the anterior approach is we can take real-time X-ray or fluoroscopic imaging to evaluate the reconstruction of her pelvis and to evaluate leg lengths. And so we could know that we were going to restore her leg length difference. The surgery took place at Miriam Hospital, took about 2.5 to 3 hours. She was up and moving that day with a walker, already feeling even and in less pain than when she came in. She stayed about 1.5 days in the hospital working with our physical therapist and recovering, and then went home with a walker, and then within 2 weeks was walking with a cane, pain-free with even leg lengths. And now she intermittently uses a cane to nothing when walking without pain.